today. Looks like it is 181.
Oh yeah, way higher than the last one. It was 157 last time.
I was going to say 7 weekers, that's usually about the range. Then they get skyrocketed during this time, and then they go down. Very good. So I'm going to go ahead and
I'm so happy the baby's okay.
The baby is absolutely fine. Beautiful. Your baby's actually doing a little bit of a headstand over here.
Huh.
The head's at the
looks
bottom.
more of like it's starting to look more of a baby than just a line.
And a line. I know 7 weekers look like a grain of rice.
Right.
They totally do. I'm going to measure your babe, okay? Your babe measures perfectly fine. Gorgeous. It measures about 8 weeks and 4 days, which is still perfectly fine. Gorgeous.
Oh, so it's behind.
A little bit, but sometimes that can happen. Okay. Definitely. Has the baby always measured exactly?
No, only one time did it ever measure exact, and that was at my 6-week ultrasound.
Okay, yep. When the baby was just starting.
Yep.
Out. Very good. I'm going to take one more right over here to get a rounded out bum. Perfect. I like to take a couple of camera plates. Gorgeous. Anyway, I can get the baby longer. Perfect. 8 and 5. Beautiful. All right, so I'm going to look on both sides here, okay? So I'm going to try to see if there's anything that's causing the bleeding. Have they found anything to be
So there was, my last ultrasound, she did find like a fluid sac right above the
gestational sac?
Yes.
Yep. I do see that. So, yep, we call it it's fancy name. Subchorionic hematoma. They call it like a little bit of like a bleed site.
Okay.
It can happen and it can cause some bleeding. It's quite annoying for mom because,
it's scary.
Especially with your history. It's like, why would I have that, to cause all this anxiety? But, sometimes it happens and usually these resolve on their own. Sometimes they can get bigger, but most of the time that I've seen them, they've resolved on their own.
Okay, good.
So I'm just going to go ahead and go left and right. Just make sure everything looks good and healthy with your uterus. I'll take a peek at your ovaries. Were you ever on any medication to help get you pregnant?
Mine back in the day, but
she did? When
I came back to the practice, she didn't have any availability. So
of course, yeah.
Definitely. Look at that heartbeat.
Beautiful, right? Ah! We're going to take some pictures for you to take home of the munchkin here.
Is that an arm?
A little bit.
Oh, my goodness. A little stub.
Once they reach like the end of 8 weeks, they start to gain like the fully grown out arms and legs. They have like little webbed fingers. It's very cute.
My goodness.
The next ultrasound, you'll be able to actually see like the actual arms and the actual legs. It's pretty. That's
crazy.
Pretty amazing. Your munchkin looks very, very good. Very healthy. There's the yolk sac right there. That usually disappears around 11 and a half weeks when the baby doesn't need it anymore because the placenta is fully developed.
So is the placenta still growing at this stage?
Yes. Okay. It's still glowing. Yeah. That's how you know that it's the end of the day. It's still growing. So placenta is all right over here. And at this point, it kind of wraps around the uterus. Yep. Next ultrasound, we'll be able to like really determine where it's going to be.
Okay.
So I see.
Is that the interior, whatever they call it?
Interior, posterior, exactly. Okay. And it plays a big role in when you will feel the baby. So usually moms with the anterior placentas are the ones in the front. They don't feel baby as early or as much. Okay. Because you have like a cushion between you and the baby. However, the ones in the back, you feel baby typically earlier and a lot more throughout the pregnancy because there's no cushion between you and the baby.
Oh, that's crazy.
So I'm going to look for that bleed site right over there. Okay. Which I do see. It's very small.
It actually looks smaller than the last one, but the sac has also got bigger, so.
Exactly. It looks bigger when the sac is smaller.
Yeah.
So I'm going to take some measurements here, okay? Mm-hmm. And you definitely, when you did bleed, you did release some of it, which...
Yeah, and it was bright red, so that's what freaked me out.
Yeah, because they always say, like, oh, dark brown's okay, it's old blood, but when it becomes bright red, it's concerning. It's very concerning, so... Anytime that happens, you said that it's down to spotting now, right?
Yeah, right now it's spotting.
Which is good. If it changes, you always give us a call. Okay. So I'm just going to grab it.
So now that blood sac, is that something we're going to keep an eye on?
Exactly. Okay. So the next ultrasound, we'll take another look at it again. Okay. Usually by, with this size being so small, usually by the next ultrasound, it will be gone. But we do check for it.
Okay, good.
All right, Mom. I'm going to go on both sides, okay?
Okay.
Perfect. Beautiful. Baby
just one.
Good. just one baby.
I can only handle one at a time.
Did you guys only implant one? Okay,
yes.
Good.
Yeah, the doctor kind of freaked me out the first time. She goes, how many did you transfer. I'm like, one.
Oh my gosh, right? Well, yeah, we have we have to know that because, I mean, I've had some people, you know, do IVF and unfortunately not have the best luck, you know, with, you know, putting in 1 or even 2.
Right.
And then I've had patients actually like opt in for 3 and they're like, oh, you know, you have the risk of triplets. And then she's thinking in her head, she's like, but it's not going to happen.
Right,
because of my history, it's just not going to happen.
Yep. And it happened.
And it happened.
Yep, absolutely.
Like, wow, okay, well, I got the warning.
It is what it is.
Your babe looks so amazing, though.
Good,
and I'm so happy that
Me
I could
too.
give you good news today. There's your little munchkin. Absolutely beautiful.
Love it.
Gorgeous, gorgeous.
Oh, he's moving.
Yes, baby's moving. Again, once they gain their arms and their legs, they can wiggle a little bit.
Oh, my goodness.
That was a cute little wiggle.
That was.
It was almost like the baby was like, okay, gotta show you this before we leave.
Oh, my God, that's awesome.
Absolutely adorable.
I just love that heartbeat. You don't even know.
I do too. Looks absolutely amazing.
That's awesome.
Beautiful.
Thank you so much.
I'm going to take this out. You're very welcome.